Yeah, that was very well stated. I guess veterans get treated the same everywhere. When it's all glory to, let's fight for America and freedom and, all that bullshit they tell you when it's really about oil and politics. But that's for another video. The point is that it's all gung ho. We love our VA, our veterans, and until you need them. And what happens is it's these side groups that are supporting veterans. It's not the Veterans Administration. I feel like meat. That's what I feel like. As soon as they can get me in and get me the fuck out, that's it. That's their job. They could care less who I am, that I'm a great grandfather, that I'm service connected injury. They don't care. That's what I feel like. I feel like meat. I've been trying to see my doctor forever. And I get this next year or 90 days. And I'm like, what the fuck are you talking about 90 days? Who waits 90 days when you're having some kind of problem? Well, you can go to emergency care. Okay, so now they know nothing about my past history. Nothing. Other than what they're looking at on their screen. Instant decisions. Here you go. Here's your antibiotics. It wasn't enough. It wasn't long enough. And I had to go back and take them again, stronger ones, for 2 weeks. It fucked up my hair, my skin, everything. My underarms still hurt. It was just, I felt like fucking meat. That's what I feel like when I go over there. There was a time 25, 30 years ago when I just thought it was ignorance, but now I understand that's how the system is designed. Any government managed care would be better than the VA. Any. Okay? Because we'd have doctors in the system. Without doctors in the system, you can have all the fucking buildings and all the MRI machines and all the technicians and all the everything. Without doctors and nurses, okay, the fucking system doesn't run. The VA immediately needs to increase the number of MRI, CAT scans, medical equipment that helps in diagnosis. They should have all the most advanced equipment, and it should be increased by 20 to 25% now. Now. So that veterans don't have to wait for diagnosis or go to an outside provider. It's crazy. It's such, the cost is so much more to the veteran, right, and their healthcare needs, that the VA is not worth it. It's just no longer worth it anymore. I actually have to split my healthcare so that I don't have to deal with going to the VA, waiting forever to get an appointment somewhere else, and then having a report sent back to me that says, oh, continuing disc degeneration, signed, da-da-da. That's it. That's it. Wait, where's my fucking doctor? Where's my doctor appointment to discuss what we just saw where this is getting really bad? What? Nope, that's it. We're done with you. Thank you. We ran through our ABCD, and that's it. You're now at E. You're fucking on your own. No consultation. They should have immediately been given a doctor appointment when those results came back. By rote. It should have just been automatic. Because it's serious. No. Nothing. So we call to get an appointment. Oh, wrong person. Here's the person. We call that person. They never fucking call back. Every time they call us from a different number, and my phone automatically says, oh, this is spam. Every fucking time the VA is listed as spam. What the fuck? See? We are better off, I'm telling you, with just government healthcare. Single payer plan. We already have enough VA hospitals and clinics spread everywhere that all we have to do is, like my place over here, this clinic, it's big enough to be a hospital. What it needs is a couple of areas added on for beds and diagnostic equipment, diagnostic equipment, diagnostic equipment, and doctors. They need 5 more doctors over there, period. A minimum of 5, minimum. People come from hundreds of miles away to come to our clinic because it's another 225 miles that direction to the next nearest VA hospital. And then, of course, 40 miles from that is another full VA hospital. We're talking about major, fucking take you 10 minutes to drive around the perimeter kind of hospitals. 2 of them within 40 miles of one another. Us, we're 225 miles away. We get a clinic. And if we need to go down there, it's a 500-mile round trip in a 10-seat fucking bus with cushions that thick, which is exactly what disabled old people need to be riding on for 14 fucking hours. It's insanity. It's just fucking insanity. It drives me fucking crazy. And it's not, listen, see, it's not the personnel. That's the point. It's not the doctors. They're doing the best they can with what they have. But insurance companies are determined to hang on to that fucking cash cow. They're determined to hang on to that fucking cash cow. Where they can charge you, for 40 fucking years they can charge you insurance, and then the day you need it because you have cancer, they find a reason to not fucking treat you. It happens every day. It's bullshit. Okay? People, instead of paying fucking the insurance company, we pay a single payer system. It's as simple as that. We allow that system to negotiate the cost of our medications. Done fucking deal. You go to Canada, you know, the insurance companies in this country always have the gurney going down a dark green hallway with a flickering light, and one of the wheels is, and they're like, this is what communist healthcare looks like. And then you go to Canada, and there's no lines, and people are like, the longest I've waited ever for an appointment was 15 minutes, and I got one as soon as I asked for one. I just walk in, I'm here, no cost, free medication, here's your prescription, there you go, that's all free, off you fucking go. See? That's the real truth. Yeah, there's problems in every medical system. Every system like that is going to have good doctors and bad doctors, just like it is right now. See? Except now you're responsible. You get graded. And you get too bad of a grade, out you go. We're not going to have you mistreating patients. See? It works. It's just the most common sense, most sensible way to go. Okay? If you want to know, look how many VA hospitals are in the United States. Just look that number up. How many VA hospitals and clinics are there in the United States?